Greetings, bariatric YouTube nation. VSG Brad here with my 1 week surgery anniversary. Yay me! I had vertical sleeve gastrectomy surgery on July 8, 2014 in Holy Cross Hospital, Fort Lauderdale, Florida with Dr. Michael Perez. That was last Tuesday. Today is 1 week later. And the numbers that I have to report are my starting weight back on October 31st, Halloween of last year. That's when I had my first meeting with my surgeon, and my weight was 346. I have a 6-month wait with my insurance, so during that 6 months I was able to lose 52 pounds, so my surgery weight was 294, and today's weight is 276, so that's loss of 18 pounds and or 70 pounds overall. So I'm certainly very happy with that. I know that first week's weight loss is going to not by any means reflect what's going to happen from here on out, but really I'm just looking for if I can get a negative number every week until I hit my goal of 200, I would be thrilled with that. That would be just fantastic. So this week's weight loss has just kind of been starvation, having protein shakes and broth and sugar-free Jello. So anyway, but good numbers to report. Congratulations, Gooch Monster, on your 6-month surgery anniversary. You've definitely been a big help in this process for me and a kind of an inspiration. So Steve L., Brave New Sleeve, congrats to you. I saw your last video and a couple things. I'm not sure about hunger either. When I eat, I haven't eaten anything, but with the protein shake, sometimes I'll feel a little pain, and I kind of check myself to make sure I didn't take too big of a sip. And the temperature, as far as drinking cold things, don't affect me anymore. At first they did, so it was maybe that, but I'm not real sure. Maybe once we get solid foods, it'll be a different feeling in the sleeve. So we'll see. Hot and cold temperature, same. I have the same thing. I was actually getting it because of the 52 pounds that I had lost. Even before, I was noticing that I was definitely a lot cooler in rooms than I used to be. And since I'm usually I was always the one messing with the thermostat in the house, I'd go over and have to turn it up 2 degrees, down 2 degrees, and even now I'm finding that I'm definitely cooler. So I think the surgery might even magnify that that effect that I've been having. As far as the staples, I think you said you had staples. I didn't get stitches or staples. There were these like clear Band-Aids that he put on my stomach. I don't know if I can get you to see one right there. That they haven't really bothered me. They haven't been itchy. They haven't been anything really really bad about them at all yet. So hopefully when he removes those on, I think he's going to take them off on Thursday when I go to see him. So we'll see. Also didn't get it drained, so I'm really glad about that. That was one of the things in some of the people's videos I was really not looking forward to post-operatively, and also didn't have a catheter in the surgery. So I got to give my surgeon kudos. At least so far everything's gone real well. Shout out to VSG Gary, whose surgery date's coming up in a couple of weeks. Welcome to the club. I know you're going to do well. You're going to do well with it. You've done your research, and to me the hardest part as it really got close was the morning of surgery. Sitting in the hospital waiting for them to come and take me back to prep for surgery was tough. I mean, I sat there. I probably only had about I don't know, I might have had a 20 or 30-minute wait, but I did have thoughts of, why are you doing this? Why can't you just lose the weight on your own? Really was reconsidering the whole thing and questioning it and just kicking myself for why I was there. And, it went fine. I went fine. I just sucked it up, went in, had it done. Coming out of surgery for me was pain-wise has been definitely the worst part. I mean, I don't remember 100% of it, but I know when I first woke up, I was really hurting for a little while, 15, 20 minutes maybe. They were starting to pump me full of the good stuff. So that helped. Once I got that under control, I really haven't had pain. I have a sort of achy soreness kind of in my side, but that might be where they took out the stomach. I'm going to find out this week on that. VSG David is killing it. He's right behind me, and keep up the good work. VSG TJ Tyrone, good luck on your. I see you're going to have the shoulder surgery, so man, get that taken care of. Get it fixed. It's going to be tough, going through it, but once you're done, you'll be glad. Range of motion and hopefully pain free after that. Today was driven for the first time in a car today since coming home from the hospital, and still want to turn corners and stuff. I just feel that pulling in my side. I don't know if that's typical or not. Again, I go to see my surgeon on Thursday, day after tomorrow, so I'll be able to ask him about that. Doesn't hurt. I mean, it wouldn't prevent me from going somewhere, but I do still feel it when you turn in a car or any kind of movement like that. Really looking forward to being able to chew food. I watched my dog. Sorry, my dog is moving the stand. This computer's on. Looking forward to being able to chew food again. A couple days ago, I started taking the bariatric chewable multivitamins, and I didn't realize it until I got to actually chew something somewhat solid. I mean, they really aren't that solid, but just the chewing motion, sort of how much you miss it. And so now I actually just look forward to even taking my multivitamins because it's the only thing I'm actually chewing. Because the next closest thing would be Jello, and nobody needs to chew that. Let's see what else I got on my list. Sorry, I gotta look at my notes here. Soft foods. I think I'm going to get to do Thursday when I see the surgeon. I believe he's going to put me on the stage 3 diet, which is soft foods, flaky fish, dark meat chicken, I believe cooked vegetables, and that just all sounds really good right now. Any kind of anything other than broth. And when I watched all the other people's videos, and I thought, oh, how bad can it be? A couple weeks of broth and protein shakes, and just suck it up. It's tough. Really looking forward to moving on from the broth protein shake stage here, and getting some food in. Even I think he had like a chicken salad made with like mayonnaise or anything like that, which did sound good. Steve L, you talked about in your video about wanting to re-drink. Same here. I find myself, I'll sit down with my big glass of water, even a protein shake, and I'll take a sort of a big mouthful, and I'll realize it before I swallow it, drink about half of it down, and then I kind of have half a mouthful of water in my mouth, and so I'll just kind of wait for about 30 seconds and then drink the rest of it. Usually okay, but it's really a habit. Even we started my walking. I've walked yesterday, I think 1.7 miles. Today, same thing, 1.7 miles this morning, and I'm drinking like a glass of water before I go, and then stopping to drink. There's a place along my walk that I can stop with a water fountain and drinking, and then drinking again as soon as I get home, just to kind of be able to hydrate enough, because you can't do that catch-up thing. Apologize the noise. Again, the puppy's got this squeaky toy that she's playing with, so I'm gonna try and get it from her. Let's see. Yesterday I made myself a goal video that I'm gonna have for when I hit my weight goal, to then be able to play back, sort of just one of those reminders of, reminders of why you should appreciate this second chance, why you should, all the things of the clothing and the airline flights and the amusement park rides, and just feeling out of breath on a nature hike, that as to why you should appreciate this chance and work hard to stay active and enjoy the new you, the new active you. So got that out of the way, which was a good thing. And I don't know what one question on that I had, maybe if anybody has any comments on, was do any of you ever have the comment creep? And I had somebody mention to me about losing weight, the NSV of, oh, you look good, and it sort of crept into my mind a little bit. I almost gave myself the, oh, I had surgery, and I know what I did to get here. I know about the hard work and the walking, the pre-surgery things, all the hoops I had to jump through, the 8 months of waiting, the pain of surgery, and I'm only a week out. So who knows from here what obstacles I'll run into. But do any of you all catch yourselves thinking that at all? When you get a compliment, like, yeah, but I had the surgery. That's, I don't know. I don't know if that's just a weird moment I have, or something that somebody else has been through. So anyway, that's I guess thinking like as what do you say, call it, Phil, a normie for a half a second, and giving yourself the bad reaction. Anyway, that's about it. I heard a sports saying recently, and I think that's what I'm going to the approach I'm going to take this attitude with my journey, and that is don't think about the game you lost last week. Think about winning the game you're in now. So if I have a rough week, that's it. It's gone. We're going to move on from there. So take that. And this is VSG Brad out. Adios.